Karen Mando, and as usual, I am with the man of the moment. I'm here with the dietitian, CEO, and founder of Diet and Health Foundation, Dr. Ituru Paul. Good evening to you, Dr. Ituru.
Thank you very much. Thank you for having me today.
How you doing? Happy New Month
Happy New
to
Month, my
you.
dear.
You're glowing as usual.
Yes, so God
You
is
have to be
faithful.
telling us the secrets
Yes.
now. You cannot just be telling us fruits and vegetables. What exactly is behind it?
Actually, it's food, nothing else. If you eat well, you glow. A man came to my office today with a wife,
Yeah.
and he said, "Doctor, do you see the way I look?" I said, "Yes, I can see." He said, "That is it." I said, "That's a good work. The moment you begin to eat well, according to plan, I can assure you, he wasn't sick when he came. It was a wife. But I'm not asking, okay, so it was less than the expected weight. Today, look at him. He's glowing in the face. He has added a little and he's so happy.
It's
So
glowing in
food,
the face and in the health.
food is so important to us.
Interesting. So I know we're going to continue. We didn't finish our topic yesterday, last week, Thursday, rather, when we were talking about preventive medicine. So we're going to go into that. But first of all, we would like to know more about diet and health.
Yes. As usual, diet and health is your friend or what we may call faithful partner to healthy living. Diet and health is here to teach you what you need to know about food. We're eating what we think was good for us, whereas those things were not good for us. And then we're doing these things in ignorance because perhaps we felt nobody was there to teach us. Now we've come here, to go down and then make you understand that food must be given attention in your life. If you give attention to your work, give attention to education, give attention to your dressing before you leave your home, you give attention to how you take care of your family and all of that. Above all, we should give attention to how we eat our food. Because if you violate the principles of dietary intake, you'll pay dearly for it. So that is why diet and health is here for you. Diet and health is here to tell you that food is not just food, but food is medicine. And that if you eat the food the way it's supposed to be eaten, it will not just serve only for food, it will serve for both food and medicine. And beyond that, food can as well help to reverse some of those chronic diseases amazingly. That is why diet and health is here. Diet and health is here to tell you that, you need to trust God and believe God and eat accordingly so that you can prevent disease. And then if you even had disease, while you've been on drugs over a long time and it doesn't work for you, just look for diet and health. Diet and health is going to help you, take you by the hand and then into the world of food. And then you should be able to reverse these conditions, these chronic diseases.
All right, where can we find diet and health?
You can find Diet and Health in the city of Uyo, precisely number 4 Udememozi Street, off Vision Road, in Sokara Fort, near University of Uyo Main Campus. The number to reach us is 090 68 20 5671. 090 68 20 5671. Don't call now, you can call later. You can also reach us on our YouTube at Diet and Health Org. At Diet and Health Org. And then for Facebook, you can reach us on Diet and Health Solution. Diet and Health Solution.
On the YouTube page, do you have diet and health, like diet tips? For
of
people
course,
that
video, yes, you can get there. All the things, most of the things we do here, we'll download them there.
Oh, okay.
And so you subscribe. Once, as I'm done today, I'll download it there. Whatever thing we have talked about today, you can get it there on the YouTube.
And so diet and health, the link
at Diet and Health ORG.
Okay.
All joined to word.
All right. Okay. Just before we proceed, a quick recap of what we did, because we cannot just continue for the sake of the people that
they don't hear us.
Yes. So a quick recap of what was discussed last week.
Okay, last week we began with what we call preventive medicine. Okay. Now we told us that preventive medicine has to do with a measure taken to prevent disease or any kind of affliction. You do not want to have one sickness or the other. There must be a measure with which you can prevent it. Initially people just felt that sickness would just come at any time. That when as you are living, you can just get sick. And that was, they believe. And then when somebody gets sick, they now were tempted to believe that it was the devil that made them to get sick. Yes. Not knowing that they were actually the primary cause of their sicknesses. So the program here is intended to let you know that if you determine to be healthy, last week I mentioned that people who go to church, they go to church because they don't want to go to hell.
Yeah.
Good. So when you go to church, you have things you must do so that you will not go to hell. You want to go to heaven. The same way you want to live a healthy life. Yes, there are certain principles you must follow. In diet and health, we have what is known as 25 principles of health. When you come, we'll teach you all the principles. But I'll be mentioning them one by one. One of them is water, Yes. Hydration is one of the principles of health. And there are many others. So we talked about all of this last week. And then I also mentioned that sickness is not the indispensable problem of aging. Many people, when they get older, like up to 50, 55, like for the men who already, some of you have had that, men, benign prostatic hyperplasia is almost indispensable. You cannot do without it. So that is why you must prevent it. When we call prostate,
that every man must have it.
Yes, prostate problem. About 90-something% of men must come across that level in their lives.
For real?
Yes, it's real. Or almost every man. So that is the reason preventive medicine must be taken with utmost determination to do the right thing.
Okay.
Yes, almost. How do I prevent it? So that's why I'm here. We tell you how you can prevent prostate problem for men, how you can prevent hypertension, diabetes, chronic diseases, heart disease, kidney disease, and the rest of them. You can prevent it. You can prevent it. It is just as you are aware now. We'll say, okay, this thing, I heard about it on radio. We can prevent it. So what do we do? You don't know how to go about it by yourself. You just come to us. That's why we're here. When you come to us, we don't give you drugs. We don't give you medication like orthodox drugs. We give you the medicine in food. We help you to eat your food as medicine. We tell you what attitude or lifestyle you have been in the past that perhaps were problem or responsible to those problems. And then we tell you how you are going to do it now. And then eventually, if you got the problem already, we'll now lead you by the hand and say, okay, this is the way to go. This is how to go about it. This is the food that is going to help you reverse this condition. And then you continue in that order. Before long, you see yourself free. So this is what we do at Diet and Health.
It's good that you landed on that note, because I'm really curious to know, how do these chronic diseases affect human beings?
Well, the chronic diseases affect us so much in different ways that we have just to give attention and learn. When we talk about chronic diseases, if we have to look at chronic diseases, damage organs. Chronic diseases, organs, damaged by hypertension and diabetes. These two conditions are what we call cardiovascular problems.
Yeah.
And so if there are people who have hypertension, they don't have diabetes. There are those who have diabetes, they don't have hypertension. But there are those who have in combination hypertension and diabetes. Their own is worse. So both essential hypertension and diabetes mellitus affect the same major target organs: the brain, the fundi, the heart, blood vessel, the kidneys, And the common denominator of hypertension, diabetes, target organ disease is the vascular trees. Vascular trees.
What are the vascular
trees? Yeah, the vascular trees, the vessels and the arteries and all the rest of the thing, the thing that connect the heart with other organs of the body.
Oh, all right.
That particular organ will be damaged. That is why somebody with this condition will have a problem of metabolic process. Metabolic process, inability to digest the food properly anymore. So your best protection is knowledge, management, and prevention. And that is why I always tell people that you need education than medication. Yes, under this context, your best protection in these conditions is number one, knowledge. We are teaching you now, so you got to learn. And then management, because I don't want to have it, so that if I have it, the enemy will not take advantage and say, I'm the one who bring this problem upon him. Okay? The time when the Bible says the time of ignorance God overlooked or winked at, but now command men everywhere. So now that I know what may have been responsible to this problem, so I put my eyes. That is the best protection. And so we need education than medication. So if you are not preventive, okay, care, you're bargaining with, number one, vision loss. Because the moment you have these conditions I mentioned earlier, hypertension, diabetes, heart disease, kidney problem, if you are not on preventive care, you are bargaining with vision loss, stroke, heart failure, heart attack, kidney failure, kidney disease, sexual dysfunction. That is the one that pains most, especially for the men. How you have a wife, you can no longer meet with your wife, you stay there, you look at each other from day to day, month to month, year to year, for one reason or the other. It can be prevented. This thing can be prevented. So high blood pressure, as I mentioned before, and metabolic syndrome, insulin resistance syndrome. So metabolic syndrome is a cluster of risk factors, including high blood pressure, that raises the risk of heart disease, diabetes, stroke, and other health problems. It is diagnosed when you have any three of these risk factors. Okay? High blood pressure, that's sugar. No, high blood glucose, blood glucose rather. High blood glucose, that's sugar. Low levels of high density lipoprotein, cholesterol in the blood. High level of triglycerides in the blood. Large waist circumference, like many people, you see their large waist circumference, very big like this, and they are happy. I eat well.
I look healthy.
I look healthy. And then this is a person that cannot sleep at night. Yes, cannot sleep. Struggling to sleep. So these are a number of issues we have to deal with. These are the stage when you have any of these problems. When you get there, you say, wow, who brought me here? How did I get here? I tell people you can age without having any of these conditions. You can get to 50, 60, 70 without high blood pressure, without diabetes, without, prostate problem. Initially, people never ever believe or knew that you can reverse prostate problem. And you know that prostate problem leads to prostate cancer. When we say prostate problem, we're talking about benign prostatic hyperplasia. Okay? Now, it is the one that leads to prostate cancer. And once it gets to prostate cancer, oh my God, you just need God to help you out. Yes. So you can reverse, number one. It can also prevent any of this condition. That is why I'm here. So today I think I will be talking about what we call tertiary preventive medicine. Tertiary preventive medicine. Because I talked about primary preventive medicine, okay? And then last week, I talked about secondary preventive medicine last week. So today, let's go into what we call tertiary preventive medicine or preventive care. Now, in tertiary preventive care, it is used when an illness has already manifested itself. This type of prevention is to be understood as damage limitation. That means you prevent the damage let the damage not continue. That's what we call it damage limitation, which aims to prevent the progression of a disease and or to avoid complications or consequential damage to major organs. You see, once it begins, like I talk about major organ damage I mentioned before, if it did not stop, it will continue to damage the organ. And what do you think will be the end? The moment the major organs are damaged and it gets to a point that the person is no longer doing what he could do before, what you never expected begin to happen. Okay, so you can stop the organ damage. And at that point, you begin to do what we call repair. Today, I posted something on Facebook. I talk about how to, how the body can heal itself. So, in medical nutrition therapy, what I do, if you're able to stop the damage progression, the next thing to do is to embark on repairing those organs through food. Remember, the body organ is not mechanical. It's not electronics. Okay? It's not rubber. It is biological. So it is food alone that can actually do the work of repairing those organs. And then, yes, I tell people, if you have been on drugs for a long time, you take the drugs, and instead of repairing, it's deteriorating. Instead of getting relief, it's deteriorating. So what do? Let's go to food. There are certain food you can eat that can help the system. There are certain food you can eat that can help the eye, recondition the eyes again. There are certain food you can eat that can help the prostate condition. There are certain food you can eat that can help the arteries, the blood vessels, clean the kidneys, and then the heart and all of that. That is a repairing process. Okay, so then that is, I'm still talking about, secondary preventive medicine. Yes. Now, you have to diagnose in preventive medicine. Modern diagnosis represents, or diagnostic measure represent an important pillar of preventive medicine, because even when good prevention, illnesses can still occur. It is of immense importance here that they are diagnosed as early as possible in order to have a good chance of successful healing. Yes, many people will take one, treatment for another thing. That is why going to local treatment is not the best. Some people say,
like herbs?
Yeah, like herbs.
Okay.
People say na herbs, so and a natural nango. And so they walk to the village and meet one old man or one old woman who does not diagnose the problem, who does not even know how to check the vital signs in your body. They just keep you there and begin to give you root, give you some whatever substances, and you drink.
Mix up some
No,
stuff.
no. We've gone beyond that level. Okay, so the major thing you need now is to diagnose the problem. When the diagnosis is done, we'll take time. Come to our office, we'll investigate, we'll do one test, from one test to another, and these tests are not expensive. They are not expensive. We are doing all of this to ensure that we do not do the mistake. Even though you are going to use food to help yourself, recondition your health and all of that, we ensure that this is what we are going for. If the liver is affected, we know. If the kidney is affected, we know. If the prostate is affected, we know. If the heart and all of that. If it's the eye, we know whether it's glaucoma or it is cataract. We know whether it is age-related macular degeneration. You don't just do anything, because you see, in the body system there are specific food for specific health conditions, just like medicine. So if you did not do these checks and know what you are going to apply, and you begin to, the same with the eat fruit, you begin to eat fruit, you may not get the result, because you are messing up the whole thing. You are taking one thing, you're not supposed to take for a particular condition, and in the end, you may not get the result as expected. So it's still good that you meet experts in preventive care. Let diagnosis be done. Okay, so when do you begin preventive medicine practice? Yes, In order to ensure a society with the best possible health status, preventive medicine begins at young age. Yes, young age. I was in one church on Sunday in Itam, and I told the youth, when we talk about health, your mind never ever go to yourself. You think about daddy, think about mommy, think about senior uncle up there, not thinking of yourself. That preventive care begins at your youthful age. In as much as you know that there are children in their 15, 16, 17, 20 that have diabetes and hypertension.
Let me just come in there,
Yes.
Dr. Choro. Now, I that thing that you just said, actually, it's not far from the truth.
Yes.
Because, and that's where the role of education comes in. Because while growing up, we learned in school that certain diseases start from 60 and above.
Okay.
Certain diseases affect the population that are older.
Certain population.
Yes. So it was more like, okay, as we're young, enjoy yourself. Nothing happened. That kind of thing.
Okay.
So growing up now to hear that
the story has changed.
The story has changed.
Yes.
It's the role of education, and that's why we have you, right?
Yes. So now what you were saying is there is what we call elderly people sickness.
All right.
Now, elderly people sickness include number one, age-related macular degeneration that affect the eyes.
Okay.
Elderly people sickness include, okay, let me mention prostate because it is at least from the age of 50. But there are people who begin to feel prostate problem when they are 45, 40 something. They begin to have prostate, problem. And then there's another one known as osteoporosis, elderly people sickness. Osteoporosis is a weakness of the bone density. You are no longer able to walk the way you were walking before. No longer strong, no longer able to, walk fast or run. What is affecting that person is osteoporosis. And then there's another one known as arthritis. When I was talking about arthritis, there are numerous arthritis, over 100 types of arthritis. But the one that is common with the elderly is osteoarthritis, rheumatoid arthritis, and so on. Then coupled with, the weakness of the bone, which is what I mentioned before. So for the elderly people, there are specific things you say, okay, because he's elder, this is going to affect him. But even at that, there are some elders who have come to their knowledge, who have come to knowledge of what you are teaching now. It's okay, this is what you are teaching. Many people come to my office because of the weakness of the bone. They buy bicycles, stationary bicycle. They use it in their homes so as to strengthen their legs. Because if your legs is no longer strong, you can no longer go for meetings, gatherings, even church you cannot go. And those people have come to testify that yes, they can now attend functions. But for the youth, hypertension, I've seen people come to my office with 20-something years, they have hypertension. Less than 10 years, they have diabetes. Kidney problem affect children 12, 13, 14, 15. So are you saying that these people are old? No. What about ulcer? Ulcer begins to affect people at their young age. So there are things you can do to prevent ulcer, prevent kidney problem, prevent diabetes, prevent all these problems that are identified with both the youth and the elderly people. So it is no longer something they say because I'm old. Okay, what about infertility? Is it not common today? People having infertility. I mentioned it the other day. I said when a young lady grows up with estrogen dominance, the chances are that when it is time to say, let me settle down and begin to give birth to children, you would see that, no, it's not going to come the way you think because of estrogen dominance. And then some other factors too. So a number of things that happen to us require that we have a knowledge of preventive medicine so that we can begin to see how we can, get out of this mess. Because this mess is eating us up. The intention is to cut off our life. The intention is to make sure that we do not live up to our good old age. The intention is to give the devil the glory so that, something you never expect to happen to you. So you have to prevent it. So preventive medicine is what you need, if more than any other thing.
Very insightful, very insightful edition today of diet and health. We cannot close because I know that there will be questions. There will be people who would like to meet you now because there's more. We're delving deeper and deeper into this
Yes.
issue
Yes.
that is biting into the society. So we would like to know your contact address again. So just for questions, just for people that need to meet you, do their diagnosis and get their preventive though we're going to still talk about this next week,
All right.
or we'll still like to hear from you. Your contact address.
Okay, we are at number 4 Udememose Street, off Vision Road, Nsukara Fort, Uyo, near the University of Uyo main campus. And then our contact is 9090 090 6820 5671. 090 6820 5671.
All right. Thank you so much, dietitian, CEO and founder of Diet and Health Foundation. Thank you so much. We're going to continue.